Hello everyone, welcome to Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation, and as we are counting down to Christmas, I just felt that we should pay some attention, careful attention on what I term the fourth law. And before I tell you what the fourth law means, I have a quick announcement to make. As you all know, we are the Brain and Body Foundation, and we do a lot with regards to charity and support for children with brain disorders and now sickle disease. As a matter of fact, we've been authorized and deputized by the Federal Ministry of Health to address sickle cell disease, not just address it. Addressing obviously includes a lot of things. Teaching about it, educating the masses about it, training healthcare professionals about how to address it, but also providing what we would term nutraceuticals, things that can help to rebuild the body. Okay, let's talk about today's topic, the fourth law. You might be wondering what that is. Well, if you remember, we've talked about the laws of life, and these are the regulatory operating principles. These are the fundamental, the basic principles that affect all of life, all of human life to be specific. And if you might have to go back to our prior tapes on the NTA website or on websites. Did I say tapes? Gosh, that just shows how old I am. Past recordings and links. Yeah, you could probably find a link on our website. But the laws of life are things like what we do as human beings, and that includes how we eat, how we sleep, how we think, how we feel, the kind of work that we do. The fourth law is this, as you can imagine, is a central law. There are three above and three below, and these are all arranged in order, specific order. What the words we speak to are very, very important, but the fourth law has to do with our nutrition, or what we put in our mouths. And when I say nutrition, everybody's like, well, we know about that. We need to take a lot of water. We need to take this. We need to take carbohydrates. We need to take proteins, blah, 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 blah. No. It's much more than that. It affects everything. It affects the way you think, believe it or not. It affects the way you sleep. What you put in your mouth or you don't put in your mouth affects how long you live, obviously, and it affects how the drugs that you take work or not work. And I think it's to be regrettable that we as medical professionals aren't impressed enough about the importance of this law, because patients listen to us. Patients will not listen to anybody else except they hear from us first. And if we don't understand or appreciate the importance of nutrition, we won't be able to pass that along to the patient, and therefore they won't take it seriously. So I'm hoping that with what we're doing with NTA and with the Ministry of Health, we will be able to change that. Now, how did I get involved? It certainly wasn't in medical school. It certainly wasn't when I was training as a doctor, treating patients with cancer. It wasn't in any of those things. It was really when I started looking at brain disorders. And as you know, we focus a lot on brain disorders, everything from cerebral palsy to autism to Alzheimer's disease to stroke. But when I started looking at brain disorders, I realized that all the drugs, all the tools that we were using simply weren't cutting it. They weren't. I don't want this to be an indictment on the medical professional, but it just wasn't getting the results that we were hoping they would get. And it's understandable too. The brain is the most complex piece of machinery in the known universe. There's nothing more complicated than it. So simply one drug or two drugs isn't going to do the trick. And once there's damage, it's almost impossible to get full function back, especially if you're just using drugs. And that was the frustration I had in medical school. In medical school, we had all these super smart professors and lecturers who were teaching us about the brain and brain disorders, and we would have pages and pages and pages and pages of description about this disease or that disease. But when it came to the management and how to address it, we would have like 3 lines, 4 lines, maybe five lines at most. And basically it was just like, you just have to manage it. Yeah? You can do this, you just treat symptomatically. It wasn't really addressing the core of the problem. And so, I mean, not to say there haven't been some great successes, especially in the field of neurosurgery, but when it comes to psychiatry and neurology, it's a lot more difficult. Again, because the brain is so difficult, so complex. So back to my point, nutrition plays a central role even in brain disorders. And I like this quote. This is probably, I would say, the most important quotation I've ever read on, and I've used on the field of nutrition, and it's by a giant in the field of biochemistry and nutrition called Roger Williams, and it simply says this: the human body heals itself, and proper nutrition provides it with the resources that it needs to accomplish that task. The human body heals itself, or it repairs itself, and proper nutrition provides it with the resources that it requires to accomplish that task. And so when we started looking at nutrition, when we started saying, okay, what does the brain need, for instance, to repair itself? What does the gut? What does the heart need? What do the bones need to repair itself, to function, to detoxify? And we started looking at these things, and we started looking at the studies that had gone before. Of course, a lot of research is being done in the Western world. And we decided to start piecing these things together and say, okay, what if we add this nutrient to it? What if we add that nutrient to it? And again, this was all done under the supervision of the Federal Ministry of Health, so we are covered. And so we started looking at these things. One of the things that we found out that was super important was omega-3 fatty acids. And so we started using omega-3 fatty acids in kids. We're having kids coming to us from everywhere with cerebral palsy and brain damage. And so we started using that, and the results were phenomenal. In the next segment, I'm going to talk a little bit about what you should avoid and what you should use when it comes to nutrition. Just kind of give you a bird's eye view and some intelligent way to look at it. So we will see you soon.